Lori Snyder. I am a behavioral health nurse, certified health and wellness coach, and I also live with ADHD. And today I'll be your moderator for today's session. So just quick reminder before we begin, the session is intended for adults and is for general educational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. Coaching services discussed today are non-clinical and do not include diagnosis, therapy, or prescribing. So please consult a licensed healthcare provider with any medical questions if you are experiencing thoughts of self-harm or feel unsafe. Please call 911 or your local emergency number. Let's get into it. Who here has ever found themselves in the middle of an argument wondering, how did this get intense so fast? Well, you're not alone. For those of us with ADHD, conflict can escalate quickly. And what starts as a small disagreement can spiral before we even realize what's happening. I know this happens to me all the time. So today we're going to kick off a two-part series on communication and conflict. In part one, we're going to explore why ADHD minds tend to escalate during conflict. And we'll introduce you to 3 practical strategies you can use to interrupt the pattern. So joining me today is Dr. Amy Marshall. Amy is a licensed clinical psychologist who specializes in ADHD assessment and support. She brings both clinical expertise and a practical real-world perspective to this topic. Welcome, Amy.
Thank you. Hi, I'm Dr. Amy Marshall. I am a licensed psychologist. I have a private practice and I've been licensed since 2016. My practice does both therapy and evaluations for children, adolescents, and adults. And then I also do ADHD assessments with Mentavi and am a clinical advisor with Mentavi. And I also am ADHD. So conflict is something that comes up constantly in my work, both in assessments and in therapy. One of the most common things I hear is I don't know why I react the way that I do. So today, I am very excited to help unpack that and give you some tools that might be helpful.
All right, Amy, so let's start with the why. A lot of people with ADHD feel like they're overreacting or being too much during conflict. So what's actually going on?
Sure. So that is not a character flaw, but it shows how emotion processing can show up when you have ADHD. So a lot of research shows that many adults with ADHD can experience what we call emotional dysregulation, which is difficulty managing the intensity and duration of our emotional responses. During a conflict, our emotions can spike quickly. And when you have ADHD, not only does that spike happen faster, but it also can take longer than other people to come back down. This isn't being dramatic. It's not being overly sensitive. It's just how intense that emotional experience can feel. So response inhibition is a type of executive functioning that helps us to pause before we react. It's a form of impulse control. For many people with ADHD, that pause is harder to access, especially when our emotions are running high. As a result, words come out before we've had a chance to think it through. We might interrupt, we might escalate, and we might say things that later we regret. And then rejection sensitivity adds another layer. Basically, a lot of neurodivergent folks, including those with ADHD, can experience more sensitivity to perceived criticism or rejection compared to neurotypical brains. During a conflict, even neutral feedback can feel and be perceived as an attack. And then that intensity can drive defensiveness or withdrawal, which make it harder to de-escalate and come to a resolution. So we reframe this as understanding why this happens, because that empowers us and shifts the narrative from what's wrong with me to just, this is how my mind works and I can learn to work with it.
Great, thank you. So we've got emotional intensity, difficulty pausing, and sensitivity to rejection all coming together. So Amy, what does that actually look like in real life, and walk us through what happens?
Sure. So this creates a pattern and essentially a cycle. Starts with the trigger. So something happens, whether it's a comment, a tone, I forgot to do something, or even just I perceive something a certain way, which leads to a spike in the emotions. So the ADHD brain reacts very quickly, and it's just a flood of emotions that aren't, that there's not time to process. Then the impulsive response, which can be words, something defensive, sharp, louder volume than we intend, leading to an escalation, because obviously when someone comes at you like that, the impulse of anyone, regardless of neurotype, is to also react. And then the conversation spirals, feeding off of each other's energy, continuing to escalate. And then in the aftermath of that, there's shame, guilt, and withdrawal. And oftentimes the initial issue doesn't even get resolved. This can be hard to break because in the moment, it doesn't feel like a pattern. It feels urgent, it feels necessary, it feels very, very important. By the time we realize what's happening, we're already so far into it that it's hard to pull out of the spiral. The good news is you can recognize and change this cycle. Patterns that we recognize can be easier to interrupt. And the strategies that we're going to talk about next are designed to help you to catch the cycle and disrupt it early, because that can make a difference in what choices you make and how you respond.
All right. So let's go ahead and get into those tools. So the first strategy I often use for myself, we call it the pause and return method. Amy, can you walk us through how this one works?
Yes. So pause and return is a structured way to step away from conflict without abandoning the conversation or avoiding the underlying issue. It protects both parties from possible damage from when the emotions take over. So there's research that backs this up. Essentially, the initial emotional surge can settle within even just a few minutes if the person can step away from the situation and regulate themselves. Although, of course, individual experience, your mileage may vary. The pause creates space for reflection, and it forces you to stop and think before you re-engage. So the first step is to name what's happening. You might say, I'm having a big reaction right now and I need a few minutes, or I want to finish this conversation, but I need to step away. Then setting a time to return, which could be, can we come back to this in 15 minutes? The important thing is that you do return to it, because this isn't meant to be avoidance or rejecting the other person, just taking that time to regulate. And then actually return to the conversation in order to build that trust. If you need more time, you can communicate, I need a little bit longer. Can we try in 30 minutes instead of 15?
Okay. All right. So I know for myself, I've had to learn to do this quite a bit. And often what I say is, I really care about this conversation, but I'm overwhelmed right now. I'm flooded right now. Can you please give me 10 minutes and I'll come back ready to listen? It's definitely not perfect every time, but it definitely does change the outcomes more often than not. So that's when I really try to engage when I remember. So
Sure.
yeah. So the second strategy is called the mind up. So this one is especially helpful when you're carrying a lot of emotion into a conversation or when you're spiraling after one. Amy, tell us more about this one.
Sure. So what the mind dump is a quick and private exercise to externalize the thoughts that are in your head. It's useful before or after a difficult conversation. So the goal is, when you have ADHD, it can feel very chaotic inside your brain. So the goal is to get that chaos out of your head. And that can be physically written onto paper, typed onto a screen, whatever works best and is available for you. I prefer to type because I type faster than I write. So it works because ADHD brains can hold a whole lot of competing thoughts at once. And during conflict, that internal noise makes it harder to focus on the actual issue. So putting it outside of yourself reduces the cognitive load and clears space so you can respond rather than react. You can do this, you can set a timer for 3 to 5 minutes. And then during that time, write down absolutely everything, no filtering, no editing, just getting it out. What are you feeling? What are you afraid of? What do you want to gain from this conversation? What's the worst possible interpretation or assumption that you're making? And what might be maybe a more generous or realistic interpretation of the interaction? And then when you're done, look back over what you wrote and find the one thing that matters most, the real issue that is hiding underneath the noise, the thing that's really bothering you, to getting to the root of it. And then let the rest go for now. No one conversation is going to address absolutely everything. This is very helpful before a conversation that you're dreading, after a conversation that maybe triggered some spiraling or like kind of still spinning after a conflict, or just when you can't stop ruminating on something that somebody said.
Yeah, definitely. I know I experienced that a lot, and that is really helpful for me as well. So, okay, great. So let's go on to the third strategy, which is called the body check. And this one helps you catch escalation before it takes over. Amy, how does this one work?
Sure. So the body check is a quick internal scan that is aimed to help you notice physical signals and emotions as they're rising before they peak. Your body might show early signs of escalation before you are consciously aware of them. So you might notice a physical sensation like muscle tension, clenched jaw, increased heart rate, even more heat in your body. These are all early warning signs. And if you notice them sooner, you might be able to intervene before the escalation increases. So we do this by learning our signals. So what does your body do when you're activated, and paying attention to those signals when they're less intense? Again, that can be tension in a particular part of your body. For a lot of people, it's their jaw, feeling tightness in your chest. You might notice that your voice is getting louder, or that you're breathing faster than you were before. And then checking in with yourself regularly, just seeing, what is my body telling me right now? You can do this literally anywhere in real time. And then when you notice that physical sign, that's your prompt to take a minute, breathe intentionally, or use one of the other, like the pause and return method, to regulate yourself before it gets out of control.
Right. I know for myself, um, when the physical cues for myself are definitely the jaw clenching. I do that all the time. And then also my voice getting louder or more pressured. That's definitely something that I need to be aware of. And once I was able to recognize that those were my cues, I had a head start on catching myself. So it doesn't mean that I never escalate, but I can catch it earlier most of the time.
Sure, sure.
So, all right. So we've covered those three strategies: pause and return, the mind dump, and the body check. Amy, how do these all work together?
Sure. So these are all tools to keep in your toolkit, and what you're going to use in a given moment is going to just depend on what that moment calls for and what you need. So the body check is something to just practice regularly to help you catch escalations early. Pause and return helps you to step away without damaging your relationship. And then the mind dump helps you to process information so you're not having to carry all that noise with you everywhere that you go. And remember that the goal isn't to be perfect. You're not going to catch every escalation. That's okay, and that's expected. The goal is to interrupt the pattern more consistently over time, and try to approach and repair more intentionally when escalation does happen. Practice is essential. All strategies feel awkward at first, and the more you practice them, the more natural they feel. Also, the more you practice them when you're not in conflict, the easier it is to tap into them when you are in conflict.
Great. All right. Well, those are all really good tips and things that we, should remember to practice when the opportunity arises. And we do have a worksheet that we will be sharing with everybody. I believe Allison is going to pull it up right now. And this is just to help you basically reset. We have the three different strategies here. And these are just prompts that can help you, get back to regulation and help you figure out what these things are for you, basically. So I believe we will be sharing the link to this, or
Yes.
we will be emailing it.
Dropping it in the chat
Awesome.
now.
Yeah.
Nice. So hit download.
So we're definitely, want everybody to have access to that and, just let us know if you think it's beneficial,
Mhm.
what the way I like to look at things like this is like we're collecting data, it's just information to help us figure out our process basically and figure out ways to be better or to work with our ADHD mind instead of against it like we usually tend to do.
Let's see. Beautiful. Okay. Well, we appreciate you taking the time to join us today. We know that these topics are really important. There's also a lot to unpack. If you need extra assistance at all, feel free to reach out, mentavi.com. And then, of course, our coaching service is available if you'd like to connect with Valerie to work on some of these things or any concerns that you have. You can go ahead and schedule everything through mentavi.com. And stay tuned for our upcoming series in April and May. We're going to start moving into ADHD and family dynamics. So that'll be a pretty great topic as well. So have a wonderful rest of your day, and thank you again so much.
Thank you.
Thanks, everyone.